Dale Bautista. I work at the Coordinated Health Allentown campus. I'm part of the primary care division. I do hospitalist type work, inpatient. I see patients at our care on demand division, which includes seeing patients for any type of injuries, whether it be sports, musculoskeletal, urgent care type stuff. I also do a lot of employer health. I was born in Hawaii from immigrant family, Filipino immigrants, but I was raised in Philadelphia. I went into medicine simply because I wanted to know everything about the human body. Everything from gross anatomy down to microscopic function. Plus, I just always wanted to be in school. I liked school a lot, and I wanted to learn everything. I was a science major in college, and I was a lot more of an athlete in high school. But when I came down to college, I was really into the books and the science of everything. I went to college at Temple University. I went to medical school at the American University of the Caribbean in St. Martin. One of my strengths with what I feel is in my patient care is communication. Not everyone's a medical professional, not everyone knows terminology, and I tend to simplify things. Part of the practice and part of the fear of patients is that they don't want a physician who's going to tell them exactly what has to be done in a language that they don't really understand. When we see a patient here, I think number one is when you find something that you have to deal with a patient. I think the number one thing you really should address is educating the patient. The ability to actually communicate that to a layperson who's not really medical is very important. Number one thing I do when I get out of here, I look at the weather. I see if I have enough sunlight to pedal, be outside and get a sweat going. My number one sport is mountain biking. I do some of the aggressive downhill type mountain biking. Protection, that's number one. Always remember protection. Helmets, pads. So any cyclists out there who leave gear, I totally empathize. And number two would be surfing. I surf. People say there's not a lot of surfing in Lehigh Valley, and they're right, there's no surfing. But the Jersey Shore is close enough. A lot of these ailments that people come in with, I've had them or I have them currently, and when they tell me there's pain there, I know what it's like. When I'm not here, especially in the fall, I'm spending half my time at Lehigh treating the athletes there, and there's a part of me there that the reason I do that is because I was never able to play sports in college. I was too busy in the books, and I sometimes live vicariously through the defensive linemen that are there, that are guys that are 3 times bigger than me, that I could have never been. Well, the good thing about medicine is that you're constantly learning about something. You know, your training never stops, even after residency, after fellowship. Once you get into practice, it's a whole new ball game. You see things you've never seen before, and the learning is still there. So when you come into my office or any of the offices here, you'll sort of get that sense that, okay, these guys, they know what they're doing and they know how to tell me what needs to be done. In addition to that, the patient experience here at Coordinated Health, it's almost one-stop shopping. So you come in, something's wrong with you, you need a study done. Studies are done within a day or so. Follow-up is very quick. And people like to know, patients like to know that their care is being done in a timely manner. When they are waiting on a study, they don't want to wait 6 weeks before they find out what's wrong with them. That's one of our strengths here at Coordinated Health, is just that our urgency of care is top-notch, and we get people better fast.